Hello, everyone. This is another public service announcement from entelehealth.com. Don't use Dr. Google. For accurate and appropriate answers to questions regarding your health, we are healthcare providers at entelehealth.com, your trusted virtual urgent care center. Today, we're going to talk about an essential skill for every parent: how to take your child's temperature correctly. Understanding this can help you gauge your child's health and know when to seek medical advice. First, let's discuss the different types of thermometers available. 1. Digital thermometers. These are the most common and versatile. They can be used orally, rectally, or under the armpit. They provide quick and accurate readings, usually within a minute. 1. Infrared thermometers. Often used for forehead or ear measurements, these thermometers are non-invasive and give results in seconds. However, it's essential to follow the manufacturer's instructions for accurate readings. 1. Glass thermometers. While less common today, these mercury or alcohol-filled thermometers can be used orally or rectally. They take longer to read and require careful handling. 1. Pacifier thermometers. Designed for infants, these thermometers are easy to use, but they may not always provide the most accurate readings. Now let's go over how to take a temperature correctly. For oral readings, place the thermometer under your child's tongue and ask them to close their mouth. Wait for the beep before removing it. For rectal readings, apply a small amount of lubricant to the tip. Gently insert it about ½ inch into the rectum and wait for the beep. This method is often recommended for infants for the most accurate results. For axillary armpit readings, place the thermometer under the armpit, ensuring it's touching the skin, and keep the arm close to the body. This method is less accurate but can be useful in a pinch. For forehead readings, sweep the infrared thermometer across the forehead according to the product instructions, ensuring it's in the right position. Now that you know how to take a temperature, when should you worry? A fever is generally defined as a temperature above 100.4 degrees Fahrenheit, 38 degrees Celsius. For infants under 3 months, any fever warrants a call to your pediatrician. For older children, a fever above 104 degrees Fahrenheit, 40 degrees Celsius, or lasting more than 3 days should prompt a medical consultation. Let's clear up some common fever myths. 1. Myth: a fever always means a serious illness. Fact: fever is a natural response to infection. It helps the body fight off germs. 1. Myth: you should always give fever-reducing medicine. Fact: it's fine to let a mild fever run its course unless it's uncomfortable for your child. 1. Myth: a warm bath can lower a fever quickly. Fact: while a lukewarm bath might help comfort your child, it doesn't significantly lower a fever. For more information on managing fevers and caring for your child's health, get a free fever guide at entelehealth.com. This video is for educational purposes only. Always consult a healthcare provider at entelehealth.com for personal medical advice. Entelehealth.com is the trusted virtual urgent care provider offering affordable telemedicine services across New York, New Jersey, Connecticut, and California. This channel is not affiliated with any hospital. Thanks for watching. Please like, share, subscribe, and leave a comment if you have other health topics you'd like us to cover. And leave Google for anything but your health. Leave that to us.